I had prostate cancer and I chose surgical removal. And what I wanted to do is at least take the time to talk to somebody who is going through the discovery phase right now because I couldn't find information out about what was going to happen. And so what I wanted to do is just be able to share it. Now, my name's John Casey, and what I want to do is document my last few weeks of hell and just share my story in order to pay it forward to help you. If you're going through the same thing, at least you have someone that has been there and done that. I'm going to tell you about my journey and the decisions we made and the surgery and the stuff that I learned the hard way in an effort to make it better for you. Everybody has to know your story is going to be your story. I'm talking about my story, what happened to me, and please don't use what I'm saying as a predictor of what's going to happen to you. Well, you probably know a lot of people have a lot of prostate, and you've got all these things. I didn't think it was going to happen to me. Last year in my annual physical, I had the PSA rise to 3, and my doctor said, "Hey, you got to go to the urologist and check it out." So I did, and the urologist said, "John, you've had a cold for a while, and that sometimes it can act up. So why don't you come back in 2 months?" So what I did is what normal guys do. I said, "Hey, this guy's just trying to extend the service, and there's nothing wrong. I don't feel bad, and there's nothing there." And I blew off the return visit. Well, this year, my PSA hit 5. And so something was really going on. And my internal doctor said, "John, you got to take care of this. This is bad." So I visited the urologist and we did the biopsy. It's kind of an embarrassing thing. It doesn't hurt all that much. They use anesthesia and that kind of stuff. And the next couple of weeks were disgusting because I had blood in my urine and some other disgusting things. But overall, it was not a painful experience, just kind of minor discomfort. Well, a couple of weeks later, my wife and I go back to the urologist that did the biopsy, and bam, he says, "John, you got cancer." I had no symptoms, no issue. I've never been sick. I didn't feel bad. I had none of that stuff. And here he is telling me, and he's proven to me, that I've got cancer. So Cindy and I, we walked through every option. I am so lucky to have such a terrific wife. She's been a rock star. I couldn't do it without her, and hopefully you got that as well. But what I discovered is, the main options you have are surgery and radiation. And there's pros and cons for both. It's an individual decision that you have to make, and we chose surgery. I knew it was going to be unpleasant, and knew I was going to have to go through a recovery. I'm not a patient guy. I'm a very impatient guy. I just need it to be over. I want to be through this thing. And Cindy felt the same way. I had confidence in my surgeon, Dr. Rosenberg. And so on August 13th, 2019, I manned up and I did it. Now you got to say, "Hey, why don't you just not do it? Why don't you just blow by and do something else?" You got to remember, this is an entry cancer to other more elaborate things. So if you catch it when it's small, you're going to be way better off. And if you put it off, you're putting yourself at major risk for bone cancer, liver cancer, pancreatic cancer, all that other kind of stuff. And man, you don't want that. You really don't. Well, surgery. I hate hospitals. I hate I'm bad with needles. I don't like it. I don't like when they take blood. But I rationalize. There is no way around it. It's either cancer or surgery. And we chose surgery. We didn't want the radiation because it was going to take too long for us. It wasn't my pick. Your pick, you pick whatever you want. But surgery was my choice. Surprisingly, most of the issues turned out to be in my head. Doing the IPV prep and all the shots really didn't hurt that much, but I made it worse than it should have been. I was mentally worked up and I acted like a wuss. I was a crybaby, and it's just the way it is. Once I was prepped, I really didn't feel any pain until the recovery. The anesthesiologist knocked me out, and the next thing I knew, I was in a recovery room. I remember the anesthesiologist said, "We're ready to go." Dr. Rosenberg says, "We're ready to go." And the anesthesiologist looked at me and says, "John, I'm going to help you relax." And that's the last thing I remember, those words. So now I'm out, Next thing I know, I'm kind of waking up. I'm in this room and I don't know where I am. And up walks Dr. Rosenberg. and he looks at me in the face, and I'm kind of groggy, and he says, John, the surgery went well. Successful. I'll talk to you tomorrow. And then he disappeared. Boom. So, it's kind of the anesthesiology that was happening. Well, next thing I know, I'm waking up in the recovery room, and there's sitting my wife. And we have a chance to talk, just her and I. It felt so good. A little bit later, my daughter came in, and she just made me feel so terrific. I think she was checking to make sure I wasn't dying, because I know she cares, but really, to me, it lifted my heart. I hated all the tubes. I hated the IV. I knew they were all necessary. And the biggest aggravation and the embarrassment is the catheter. Got to remember, all your urine just drips into a bag, and some poor nurse has to come in and empty it. To them, it's part of the job. To me, it was embarrassing. Getting up to walk was a huge thing. I was scared that it was hurt. It was a little pain, kind of like doing some sit-ups. It just hurting your stomach a little bit. Walking around the IV pole is awkward. And I want to give you a massive recommendation. Bring a robe. My wife was so smart to bring me a robe. We draped it over my shoulders. These hospital gowns are disgusting. They're open in the back. It's just bad. I don't know why the hospitals don't find something better, but bring a robe. It made me feel so much better. And also bring a recycling shopping bag, like you get at Trader Joe's and that kind of stuff. Because you can put the catheter bag inside the shopping bag, and you just look like you're walking around with a shopping bag, as opposed to a bag full of urine. It just restores your dignity. And it made me feel good. Well, they hold most people at least one night, and I'm glad they do. We've got they've got pain relief. They know what's going to happen. You need some transition time. This is major surgery. No kidding. You are not playing games here. I really didn't sleep well that night. I dozed on and off, and they came in and checked me every couple of hours, especially when I fell asleep. They came in to wake me up and say, hey, how you doing? I said, well, I was asleep until you woke me up, and, just kind of bad. But the thing I was worried about was this damn catheter. I mean, it was hanging there, and I wanted to go back to sleep. And normally I sleep on my side, but I laid on my back to sleep because I didn't want that thing disturbed. But I got through the night, got up by myself, walked over, and sat in a chair in my robe, and it felt so good. It was so warm, quiet, nobody around. It was about 6 o'clock in the morning. Sun was coming up. But I made it through. I made it through the toughest part. My 24 hours were over, and I really didn't have a lot of pain. I was surprised. Well, the recovery day. The next day was kind of a zoo. This is the day after the surgery. Dr. Rosenberg came in and said, hey, how you doing? And he checked me out. He says, yay, you're okay. I'm going to release you. And he says, John, just be patient. The discharge process is long and tiresome. So you get into this release protocol where people are qualified to do certain things, and you got to go step by step. There's a sequence. I hated the waiting, but I wanted to get out. So what I did is I walked laps, and maybe 100 yards at a time. Walk 100 yards, sit there for 10 or 15 minutes, walk another 100 yards, 10 or 15 minutes. You got to remember, you got to take it easy. And I took it easy. I like running, I like jogging, I like doing all that kind of stuff. But I just took it slow because I didn't want anything to happen down there. Well, they finally removed the IV tubes, and I said, man, I'm making it. It's a milestone of progress. It felt so good. There was no pain, but psychologically, I said, oh, I'm getting out of here. Still had the needles in my arms, in my hand, but I was no longer shackled to that silly pole. So I could walk like a man with my bag and my robe, carrying around my catheter bag, which ain't very manly, but it is what it is. The overall discharge took around 5 hours waiting for the next expert, but I just wanted to get out. So before we left, the nurse then comes in and is giving Cindy and I instructions. And they were quite technical, and they're talking about embarrassing stuff. They're talking about my penis and how to keep it clean, and the tube coming out of it, and small traces of blood. And to me, it was embarrassing. To her, it was a medical action, no different than working with your hand or your foot. She explained how to wash and clean, and then she showed how to hook up the catheter and change it and all that kind of stuff. Cindy helped me, God bless her. But when they're doing it, you need to listen up. They're trying to help you. They do a great job, and you need to know they have seen this before. It's embarrassing to you. To them, it's just another day. So I also had something that my attitude did not want. I didn't want a pity party playing in my head. And I was playing that silly pity party card on myself, and I needed to snap out of it. So when I got help, oh man, did it feel so good. Yeah, I was sore around the incisions, but other than that, I didn't have much pain. I learned how to empty the bag quite easy. It was strapped on my leg with a valve near my knee. I strapped it up on my thigh. I just kneel on the toilet, open the valve, pretty easy. All of this fluid comes out. You flush the toilet, and it's done. And you go on for the day. That's the daytime bag. Getting in bed wasn't very hard, but putting the bag nearby was a little bit of a puzzle. My wife, Cindy, came up with a great idea. Let's go get a bucket. Let's put a bucket on the floor and take the catheter bag and put it in the bucket. And it's got to be down on the floor. It can help in the drainage. It's where you want it. It's easy to carry the bucket over to the toilet and open up the bag inside the toilet. Very easy. Bingo, bango. And it's a great backup plan. If it leaked, it's going to go in the bucket. So, no big deal. So far, it hasn't, and it didn't the entire time. So living with a bag. You're going to have this bag strapped to your leg, and I had it on my thigh, and I thought it was going to be embarrassing. After about 5 minutes, you don't notice it. It's just strapped on there. It's just there. I wore lightweight or light-fitting clothes like sweatpants. If you knew what you were looking for, you could see it. But if you didn't look for it, you wouldn't even notice. I went to the store a few times with Cindy. So you can get out and go do things and walk around and just act like normal. Just take it easy. I'm going to reinforce that. But I found that the plastic bag caused my leg to sweat. I had my operation in the summertime. So I placed a washcloth between the bag and my leg. And all the irritation went away. So it's kind of like fabric on your skin instead of plastic. Made it feel a lot better. Dumping the bag turned out to be very simple. Put your knee on the rim, open a valve, bango, bango, it's done. Ooh, cool, very quick. But that catheter, it is an irritant. But man, there's no better option, and you gotta man up. What I didn't appreciate is the impatience. I thought I was a Superman. It wasn't hurting. I wanted to work hard at the recovery. I want to recover fast. And I want to get through this nightmare. But the conundrum was I didn't feel pain in the prostate area. I thought everything down there was fine. It's not. It's healing. You have to give it time. If the bladder tube doesn't heal, you're going to be peeing inside of your body. Think about it. It's a damn inner body toxic pipeline. So you mess that thing up, you are in trouble. So I'm going to tell you, take it easy. I walked slowly, about 50 to 100 yards. The first day, I was really stupid. I was a knucklehead. I walked 1.5 miles. And I didn't walk fast, but I walked really far, and that was dumb. I'm putting stress in an area that's swollen. You got to take it easy. Don't do what I did. That's a bad move. Slowly walk about 50, 100 yards, sit down for a half hour, walk again, make it a little bit longer, be active and conscious while you're in recovery, but don't go too far too fast, and just make little incremental increases as you walk around along the way. Eating, this anesthesia is going to cause your bowels and intestines to work funny. They've got to return to normal, but at first you're going to be passing some gas. Took me 2 days before I had a bowel movement. And after the warning on the walking, I knew not to force it out. And we took this medicine called Colaze, which is a stool softener, and I'm glad I did because it really did the job. Now me, impatient John, I normally go to the commode, and after a minute, man, I'm out and force it out. You know how it goes. This time I went with no pressure and took a few tries, about 10 minutes, and finally came out. I just made it easy, just try and make it easy. When you exert pressure, you're squeezing in the area that just had a 3-hour surgery. So man, don't do it. Find other ways. So to make it easier on yourself, eat softer foods. I'm not saying restrict yourself. Mild, mild, softer foods. I like macaroni and cheese. It's soft. I like oatmeal, jello, ice cream, spaghetti. Things that are soft make it easier for you to go to the restroom and relieve the pressure. So you want to make your poop soft. Why? So that the toxic pipeline can heal and it doesn't get pressure in the commode area. Think about it. Make it easy. Eat stuff that you like that's soft. Now, the incisions weren't comfortable. I had six incisions on my stomach. And I found that placing one of those blue cold gel packs on my stomach really helped a lot. They're cold, they're soft, they're pliable. It's really an ideal device. And what happens is your incisions swell a little bit, maybe a quarter of an inch or so, not so much. And it reduces the swelling. And the cold also made the minor discomfort walk away. The bad thing is when you cough or laugh. Your stomach muscles are going to be pushing outward when you laugh or cough, and it's going to strain the incision area. I found placing my forearms across the incision to hold me in, like I've got my arms crossed across my chest when I did it down by the incision area. And it really helped a lot. And easy, simple, just provided resistance with your arms on the area where the incision was, and the pain was gone. It wasn't pain, it was discomfort. That's a better term. Now, the prostate area is down by your butt. And it felt warm and uncomfortable. Like 2 hours after, if you smash your thumb with a hammer and it comes, an hour or so, it starts to swell up and it starts to get hot and feel kind of warm. That's kind of what it felt like, a warm sensation. When I did that 1.5 mile walk, the warm kind of turned to kind of hot. So I did too much. And don't be dumb. Well, the catheter removal. It took a week. And when it came to the day that I get to go to have the catheter removed, I got nervous about that as well. I wanted it out. Was it going to hurt? How long was it going to take? What was going to go on? Were they going to put me in anesthesia? And man, this was the easiest thing that ever happened. It took less than 30 seconds. Didn't feel a thing. You got to have a doctor do it. Don't let anybody else touch that thing. And man, was it a joyous day. So you should bring these pads and guards and that kind of stuff, because you're going to have a little bit of a problem controlling your urine right after the surgery. Now, life after the catheter was interesting. You've got your body is adjusting to a different flow control system. Before the surgery, you had 3 shutoff valves. 2 were in your prostate and 1 was in your penis. And now you only got the 1. So you don't have a triple system, you got a singular system. I installed the daytime pads and nobody even noticed. I needed them for a day and then it went away. And I used them for a week, but I didn't need them. It just, I had a week target that says I go a week straight with nothing happening, then I should be okay. At night, you use these Depend type guards, and the only people who know I was using it was me and my wife. And I used them for a couple of months, and I'm still using them now. I want to go for 2 weeks with no issues, and so far I haven't done that. What I'm finding is if I ever have any kind of a hard alcohol, like a gin or a scotch or something like that, that's when the nervous system, I guess, relaxes you more, and you have a little bit of a problem at night there, and you kind of pee. When I don't do that, and I have had wine and beer, for some reason it doesn't have the same effect, and I don't have problems on those days. So, but the biggest thing about the catheter and the stuff afterward was my attitude. First day, I was having a big pity party. I was a whiny boy. I realized that this is a brief inconvenience for something that's really going to save your life. Well, now, I got through that, and I'm through most of the stuff and getting back to normal. Everybody is going to have your own schedule, and you're going to have whatever issues that you have. I'm told the return to normal is somewhere between 6 months and 2 years for most people. That's not a guarantee. For me, I'm at 2 months, and I can pretty much do anything I want. I've run a 5K already. I'm going to do a 10K in a couple of weeks. I'm now playing with the kids all the time, running around, playing, throwing footballs and catching footballs. On the sex life, it took about 30 days, and we had some help with this sildenafil. So you got to talk with your doctor, get the prescription, get it right, and it's going to help you in that area. Now, I'm no doctor, I'm no expert, but I do have a story, and I hope it can help you. Cancer is nasty, and it causes a lot of pain when it advances and it starts metastasizing and getting all over your body. I've seen it. It's horrible. Prostate cancer is something you can control. You need to get at it early. You do your annual physicals and listen to your doctors. If you're walking down my road, I wish you well. You're gonna make it. Give yourself a chance to heal. If you are as lucky as I am with a fabulous wife and a fabulous family, I guarantee you will appreciate them more than you ever could imagine. So that's my story. Good luck if I can help you. Thanks so much and best wishes to you. You can do it.